Good morning, Pat Zemer here with MagnaWave. Welcome to the MagnaWave office hours. Sorry we're a few minutes late this morning. I got here early to get everything ready, and all of a sudden I had to reload all my different stuff because everything updated, and so I'm behind the eight ball this morning. But we're glad to be here. We're here to answer your questions and have a discussion with you, whatever that may be, regarding PEMF, machines, how things operate, training, whatever it may be. And you want to ask a question, just simply post it in the Facebook chat box or on YouTube. We're broadcasting on YouTube and Facebook this morning. Tried to get my cast box back up and running again. Same problem. For some reason, everything required new logins and credentials this morning, and don't have it all here in front of me. So sorry for that, but we'll have to get that squared away and be back with cast box next week. Aaron's here this morning. Good morning, Aaron. So if you have questions, just post them in there and we'll be happy to take a look at them. Do have some questions that were posted that I would like to kind of go over at this point. One of the question is, has anyone treated someone with PAT? I guess that's Pat disease. No, I'm kidding. Paroxysmal articulations tachycardia. That is a situation where you have in your heart where you develop a very rapid heartbeat that in this particular instance that starts and stops. In some cases, people develop these tachycardias and their heart begins racing, and they have to have an injection basically to stop the heart and then to calm them back down and then get out of the situation. My wife has suffered from this in the past, and so the question is, has anyone treated someone with that? In our case, we certainly have. We have never treated during an episode that she experienced when she had it. She ultimately had to have some surgical things performed, ablations and so forth, to stop the situation in her heart. But other people, it can be treated with drugs and things like that. Various situations can bring it on. Anxiety can bring it on. Sometimes caffeine or those types of chemicals can potentially bring on a racing heartbeat and cause these things to begin. In my wife's case, we treated her regularly to keep her relaxed after she had these episodes, because they are quite they're not good, and if they aren't controlled when you have them, there could be some very devastating results. But so to that end, if someone is experiencing this type of heart irregularity, you certainly want to deal with your doctor and talk to your doctor about what's going on and what you may want to do or how you may use something. In her case, it was anxiety driven, as well as she had a situation in her heart where basically she had two openings going into the base of her heart, and so what would happen is this began and start flowing around these two openings and couldn't get out of the heart, which caused the heartbeat. She had to go in and have one of them closed because, like as I said, one of them was abnormal and wasn't supposed to be there. But so it's interesting how those things develop. So if you have that type of situation, certainly check with your doctor and tell them what you're doing for relaxation and well-being, and see if that can be utilized. Is this something that will bring that on typically? No, that's not what we do. We basically provide oxygenation and improve blood flow. Can that provide relaxation that can maybe prevent something like this or keep something like this at bay? Quite often you want to stay in a relaxed state when you're in those types of situations. Let's see, a lot of folks joining us this morning. Good morning to Tracy. Tracy's here. Janet's with us. Good morning, Janet. Hazel, Maureen. Good morning, Sandy. Sheila, Kate Myers is with us, and Samantha is with us this morning. So thank you for joining us. And again, if you have a particular question that you'd like to address, simply put it in the chat box and we will approach it. It's always important when you're dealing with these various situations. We don't treat conditions. We simply provide well-being energy to the body and let the body better assimilate this energy for better and improved healing. Now, doctors can approach this situation a little differently, but that's how we approach it, is to simply use the device to provide good oxygenation, good blood flow, and allowing the body to be better in a position to better heal itself. Okay, let's see. Does anyone have experience treating carpal tunnel of the metatarsal? Well, certainly you want to treat the area that you're having problems, and then you want to treat the areas around it. We also, no matter what's going on with carpal tunnel type of situations, is treat the back, because so often, as you know, the nerves come off the back and go to the various areas of the body. So because you're having an issue in one area and you want to work on it, you also want to take care of the central nervous system, if you will, and just keep the vitality and the inflammation and all that in those areas in a good state, or as good a state as possible. And this energy, this MagnaWave PEMF energy, is very beneficial for that. So for example, if we were doing carpal tunnel in a wrist or something, we would do the area, the elbow, the shoulder, and the back, and just to do an overall situation. Because we learned this when we started dealing with fascia. When we had issues, we didn't really think about that if you got inflammation in a muscle and pain, and you want to basically massage the area or work the blood flow into the area, that as the fascia can be inflamed all the way down to where it becomes cartilage and tendon and the whole thing. And so if you're treating a massive area of inflammation, you also want to trailer it. That's why we do full body types of treatment. You also want to trail it down to where the fascia becomes, like I said, connective tissue, because what happens is you'll treat this area and then it'll begin to creep back right away because you didn't work the full area of where there could be some inflammation. So yes, we've had some good results with carpal tunnel type of situations, but you always want to make sure that you do a broader type of situation. Now, we had a question that I was reading last night where someone was talking about ring bone in a horse and what to do, and some of our practitioners answered the question. The question was protocols, what do you do, what kind of success? And we have had some success with ring bone, because you enhance the circulation, improve the circulation in the area, which can help control what's going on and keep the body the cells and everything working in a healthier state to help heal the situation. But you also want to, as I was just talking about the carpal tunnel, treat the full body, and that's what they did. That's what one of the practitioners talked about in that situation, was to treat the overall body, but certainly concentrate on the area where the issue is and where the pain is, and so you want to expand it from there. I always talk about like an automobile accident on the highway. Everybody slows down and you get to the area and there's no accident anymore, but we got to clean everything up, get the rubbernecking under control, and go from there. So we kind of take the approach to clean the whole area, clean the highway up, get things ready to go, and things flow better and more appropriately. I was treating someone that is 10 days out of back fusion of L5. Should you treat the direct surgery site or around it? If they're 10 days out from the area, there certainly could be potentially some inflammation in the area as a result of the surgery. You can treat around it, just like I was saying, clear the highway so you get good blood flow in and out, and you can treat the area because you're several days out from, you're not going to do anything, you're not going to move anything. Now, you might be, when you're treating that type of situation, as Dr. Dreesen often points out, you want to be lower in that particular area so it's comfortable, so you don't pulse anything too hard, but you're not going to 10 days out, you're not going to be in a fearful situation that you're going to realign anything or anything like that. But you would certainly want to, again, have this conversation with your doctor. But to treat around the area and then lightly over the area would be the type of protocol to help soothe the area, to help improve oxygenation, blood flow, circulation to the area, to help the area be more comfortable through the healing process. John Stevens just arrived. Hi, John. Any update on the CE? Haven't talked to them yet this week, but I will make my call again this morning to them. They're starting to tell me at the factory that everything has been completed, and as I told you before, had to be resubmitted because the company that was doing the inspections of the factories, not just our factory, several factories, West Coast company inspecting factories that work with CE and medical devices in the European area, and that they had to resubmit their paperwork because they filled part of it out wrong. And so now you know that there's a lot of companies in line to get this finished. But I will make my contact again this morning, and I can't wait for the day that I tell you, John, and everyone else that little part of the bureaucracy is completed with regard to the CE. CE, for those of you who don't know, is the equivalent of the FDA outside of the United States and Canada, European countries. I learned yesterday that Israel is a country that doesn't they have a different system than the CE. They rely on the CE and the FDA, but they have a little different approval process, much like Health Canada, I presume. You can have a CE approval, but you still need to get approval of Health Canada if you're going to have devices, medical devices in Canada. As opposed to other countries. A lot of countries honor the CE that is European driven, and it's just if you have it in the European area, it is good. I believe it's 127 countries that accept the CE. So we're excited about that being finished. From us, from a U.S. standpoint, in order to export into a foreign country, we must be safety tested and safety approved, like a UL safety testing. So it's what that basically means is the device is built safely and no one's going to get hurt by utilizing the device and from the electrical standpoint and so forth. In Europe there is CE, that means it's electrically good, and then there's a medical grade CE, and our devices will be in the medical grade CE status in Europe. And so we're again excited about that. And then just a quick update since someone's asked the question. We have reapplied to the FDA for predicate approval. That means there are devices that are similar to ours for various indications that are approved, and we would like to be piggybacked, if you will, or predicate to those devices, and have that approval. And we're anticipating that at any time. Plus the studies that we're in process at this point to be able to be more specific with FDA uses in special areas of venous wound healing, bed sores, and osteoarthritis of the knee or body. So let me start this. I didn't get that going. So that's a situation with the FDA at this point and the CE. Any other questions? Please just throw them up. Good morning, Serena and Felicia. Thank you for being with us. If you have questions, just post them and I'll get them, whether they're on YouTube or on the Facebook chat area. Please do that. Let's see here. Any other questions? How long should we wait to do PMF treatments after surgery? As we've stated in the past, you want to do those treatments after bleeding has been controlled. If bleeding is under control and everything is stabilized and you want to go in and work on comfort, inflammation reduction and things like that, then you can approach those areas once that is stabilized. If you have any questions with regard to when is an appropriate time based on the type of surgery, much like we were talking about with the tachycardia, you want to certainly talk with the veterinarian physician or the doctor who's in control of that particular patient or situation. Can MagnaWave help get rid of tooth/gum infection? If so, is there a direct action by the pulse on the bacteria? Well, what happens in those areas, can it be beneficial from the standpoint of relieving pain? Yes, because what we're doing is an overall situation, again, to improve the oxygenation, which reduces inflammation and helps relieve the pain. If you have good oxygenated blood, this would be a case where you want to do work on the general wellness of the body, to have good oxygenation of the overall blood system. What happens when you have good, well oxygenated blood flowing smoothly? It's going to attack bacteria and hopefully aid the whatever medication's being used, but the improved oxygenation does attack the bacteria and hopefully be able to help fight the bacteria and to ease the situation. So to utilize the MagnaWave PEMF for the comfort of those situations and the better oxygenation for defending and fighting those situations, MagnaWave could certainly potentially be a benefit in those questions. Great question, John. Thank you for asking. The pulse itself is simply putting the pulse into the body, putting the energy into the body. And this is a question, I had a doctor in from Israel, so I got this information from Israel yesterday, spent some time with them, and we were talking about the pulsing, and when you turn it up, basically what happens is as you turn the device up, you put more energy into the body, into the areas that you're working on for comfort and oxygenation. And so you want to go deeper with more pulse, but you certainly want to deliver this pulse in a more comfortable fashion, so the client and your can be comfortable as they're receiving this treatment. Okay, question. I'm working in plastic surgery. When will the facelift attachment be available? Doctor is asking. And Kathleen, we talked about this a little bit last week, but we are making a pad for that. However, as I'm going to go back to my engineer from California used to tell me, we have the attachments that will be suitable for most any type of indication. And as I was talking again with the doctors from Israel who were here yesterday, is to use the application of the large loop in a situation where, in your case, Kathleen, where it could be placed on if someone wants to lay on their back, or they're on a massage type of table or in a regular chair, but they want to lay back and drape the large loop around their head like this, and overall treat the area for inflammation reduction, pain relief, more speedier type of healing situation. Certainly the large loop would be appropriate for that and to be effective in that type of situation. But we are working to bring this mat to fruition that will be more of a contour type of thing that can be draped over and placed over the face if someone is doing that type of plastic surgery. We got to test it, make sure it's comfortable, make sure it's pliable. So it is coming. But in the short run, the large loop would certainly be a way of approaching it, and you could do that a couple of ways. You could place it here directly in front of, or someone would hold it, or as I said, kind of place it over, or if they want to lay face down in a type of situation like some chairs allow to do that, you could do that. Or you could place the coil simply on the neck and treat this way, to where you're putting that energy over the whole area of the head. That's really what's important. Put the energy over the area and then let it do its job to work on those situations. Great question, Kathleen, and we are working on it. If the doctor would like to discuss that, I'd be more than happy to have a session and visit with the doc to explain what this does and how potentially they could utilize it in their practice. And we would love to do that, because we're working, there's more and more acceptance of this type of inflammation reduction processes that are beneficial to those who are having plastic surgery and other types of surgical situations on their body to speed the healing and make it more comfortable. I used my sole on a fairly substantial tooth inflammation. It was almost completely reduced within about 24 hours. Thank you for sharing that, Catherine. That is correct. When I had my wisdom tooth teeth, 4 of them at one time pulled a couple of years ago, I used the extensively treating myself to help reduce the inflammation and to ease the pain. And so tooth inflammation would be, my brother-in-law has done that. He had some issues that he needed to have dealt with a few years ago and had to go to a special dentist to get it taken care of, whatever. But he used the machine regularly until he had his appointment and was able to be more comfortable leading up to the appointment, along with other situations. Don asks the questions, what about moderation stroke? Well, any type of situation like that, once it's controlled, once it's in place to help, again, ease the inflammation, help the blood flow to the area, to help slow down situations, to help the area heal more rapidly. Certainly in situations with stroke, you have inflammation, you have damage potentially to the area, so you want to, again, make sure that if you're utilizing this for inflammation or circulation control, that you're working closely with those the doctors are those in control of the situation. But it is a situation that we've used. In fact, I just completed a chapter for my book that I'm participating in, Happy Brain, dealing, and I'm discussing how we use PEMF to deal with a couple of issues, stroke and depression, and how it can be beneficial to the healing process, the cognition, the whole 9 yards with strokes, and then certainly with the sense of well-being, inflammation. They're saying now there's been some studies that have shown that strokes are a result of, or not strokes, but depression is directly related to inflammation in the brain. So if we can help control that and keep that in check, you can help someone potentially who has in a depressive state. Good morning, Linda. Thank you for being with us. Samantha, appreciate it. Good morning from Germany. Okay, well, do you have any experiences with horses with summer eczema and MagnaWave? Well, you're talking about situations. We've dealt a lot with what they call summer sores in Florida when you have those types of things because of sand and what's going on in the heat and how it affects the dermatological aspect of the horses. Again, certainly to work with those areas for circulation. A lot of times people will use topicals on those types of issues and then use a MagnaWave to help the absorption, to help the blood flow to the area, to again hopefully help more control what's going on. Now again, you have to understand the entire environment about what's causing it, what brought it on, so you can maybe aid the area, but you have to also look at the overall picture. That's where the vets would come into play in this type situation to know what to do for the overall systemic situation or the environment that the animals are in, or in relation to that. So yes, we've had some dealing with that type of situation. We've seen a lot of good success in those areas to again help the area heal more rapidly, help the absorption of whatever is done topically, and if it's an oral medication, to help the assimilation with that in the body. Again, I was having this conversation with the folks from Israel yesterday, talking about how we approach medications, because this improvement to the body's energy can increase the metabolization of something that you're taking far as a medication. So again, it's important because most medications are designed because the body only absorbs a certain percentage of them. So if they want the body to absorb this amount, then they put in this amount. So when it absorbs 20%, they're getting the amount into the system that they want. Again, you can have that conversation. In many cases, they do the medication, let it assimilate into the body, and then treat with MagnaWave. In some cases, you may talk with the doctor and they say, look, I'd like to have a little better assimilation, so maybe as we talk about with topicals or you talk about with the medication, let's take it, let's treat, and then get a little better potential absorption. But again, that is something that you work out and you talk about and you work closely with the doctors, because you're not treating anything, you're just improving energy with the body to improve that type of situation. All right, I use meeting you get it at any feed store, and my sole and my gelding is doing much better. I'm sorry, I don't totally understand the whole question there. She's talking about probably the situation with the summer type sores, or what she was talking about using. I'm a little unclear on the comment. Maybe she could clarify it there for me. Good morning, Mary. Thank you for being with us. How do I find a practitioner in Utah? Great question, Don. What you do is you will go to the MagnaWave PEMF.com page. In the upper right hand corner is a button that says practitioners or get a treatment, treatments now type of thing. You can go there, put in your city and your information, your city and the area of the city that you're in, for example, and what it will do is it'll go out and find the practitioners who are closest to you and give you a list of those practitioners so you can call who you would like. I believe the closest practitioner to you will receive a message, so potentially they could reach out and help make that contact if you're looking to find a practitioner. It's very simple, it's very thorough. If you want to find someone in your particular area, that is a very easy way to do that. There is also the Association of PEMF Professionals. It's PEMFprofessionals.com, where you can go, and they have a map on their site of all the practitioners that are in particular areas, not just MagnaWave, but other practitioners. So in that situation, everybody can't be everywhere, but we do want you to get to your treatments that you're looking for. So that is available from PEMFprofessionals.com. If you are a practitioner and you're not yet a member of PEMF Professionals or the AOPP, you might want to look into that, primarily for the map function, because it is a repository of studies of what has been done with PEMF, and you can go there and research and see what studies have been completed by indication or name of illness that you're dealing with, and there's thousands of studies that have been performed, and you can go there, and also there is the map feature and so forth. So if you're not a member as a practitioner of the AOPP, go check it out. It's not expensive. It's $150 a year, and you get the certification. There's other training, not certification, but you get the use of their materials. They do have training that they're putting in place within the AOPP for people to get additional training or to learn more. So that's some place to go. Check that out, and I think you'll enjoy it and see what you can learn. Hope that's helpful for you, Don. Just check it out, and you can find a practitioner. I've used Lubricin or MTG in conjunction with regular treatments, and have had great results. And again, I'm sure she's talking about the summer sores type of situation. Lubricin has a new topical product that you can spray and put on those types of ailments and help the healing process. It's great. I've used it. I had a situation where I had a spider bite a couple of years ago, really severe spider bite on my foot, and I used about the only thing I could really use to get the relief and to get rid of it, which took a lot of time, was the Lubricin spray that they have. But certainly you can take that type of product, the Lubricin or other products, orally, which put it in your system to help build up your hyaluronic acid in your system, which is beneficial to the healing process. The hyaluronic acid is basically like a synovial fluid, and hyaluronic acid is throughout our body, and you want a good level of HA in your body to help many of these types of situations in the body. So that's a great question or a great comment about utilizing that as far as various indications, from joint issues to skin issues, whatever it may be, in conjunction with MagnaWave, PEMF, or what other therapies that you might be talking about. Okay, it's like an oil, Samantha says, of the MTG. Mane and tail growth is Next Level Equine told us. MTG is mane and tail growth, which is helping with the overall skin type situation of the body to improve. So certainly that in conjunction with the PEMF to help the absorption of the topical type of ointments in the body could be very beneficial. Good questions, good conversation this morning. I wish my phone was working because I had to relog in. I can't take text. If you wanted to give me a text and I'd give you a call, I'd love to do that. If you want me to call you, put your number in the chat box and I'll call you back and we'll have a conversation. Let's see. Anyone worked with show pigs as an appointment to work on some next week? Which works better, large loop or small loop? Doesn't make any difference. Treat the area, treat the animal. What you're looking for is comfort. What we've learned in this type of area, same thing with show cattle, and actually any type of, and this can go for humans as well as animals. But in a show pig, for example, and in cattle, the gait, their relaxation is important. So by treating them, they're more relaxed. They perform better to what you want a show pig to do when it goes into the show pig ring to have that type of activity. So basically I would say the large loop over the animal, maybe the butterfly on the flank and the back, different ways to approach it. Certainly it depends on the size, which attachment is best for you. People develop their patterns for which attachment they like to use, and people ask all the time, what's the best attachment? Well, it depends on what you're doing. We've had docs that have come in, or people come in for training, and they go home and they use the paddle all the time. That's the principal go-to applicator. Myself, when I was treating, I used the butterfly almost all the time as opposed to the large loop. It gave me versatility to open it up. It gave me a little more intensity if I wanted it. It allowed me to easily get into a joint situation or work the top line of the horse as I went down, doing the Shiro's principle from the top of the head all the way down the top line. It's just what I used, and it worked out very well for me. So people utilize. There's not one in particular that is the best and the one that should be used in those situations. It's whatever you're comfortable with. Okay, let's see. Zoe writes, good morning. Thanks for being with us. Again, if you have a question in your chat box, just put it in there, or on YouTube. If you're with us on YouTube, we'd certainly appreciate your comments and be able to answer your questions there. Let's see what else we have here. Any other questions that may be? Rectal colic condition. Don't know what that, ought to probably look that up. Daily treatments, 20 minutes, see how it reacts. Any other recommendations? Well, I'm not familiar with the condition. Rectal colic implies that it would be in the rectal area, and certainly, unless that's a total change in what I'm reading there, but no. But certainly treat the area, treat the body around it to help with the situation. Again, we do not go on specific conditions and specific indications. We like to treat the area to get some comfort and relief, and then hopefully improve the oxygenation of the body to allow the body to better do its job and heal itself from that perspective. No other questions at this point. We're moving along. We were a little late getting started this morning. I've already talked about that. Had a horse colic in surgery. They found flipped colon and no impaction. The horse is doing well the first 2 days after surgery, but now isn't doing well. She hasn't had a bowel movement in over 24 hours, thinking possible secondary colic. When is it safe to MagnaWave in this type of situation? Again, you want to certainly work in conjunction with the veterinarian. But what we've learned, and I'll just give you the quick story, in the beginning when we were talking, we would say, can we treat colic? And the typical answer was no. We want to let things happen. But as we went along, vets began to understand that we could have some circulation enhancement, some massaging type of effect on the area to help move whatever the impaction might be along. And it's important to also know if it is flipped, if there is constriction, then we're not going to be able to help that much. But if it's a situation of a blockage, whether it's gas or a buildup or constipation, whatever it may be, to massage the area with a good pulsing movement, we have found can help relieve and move things along. And you want to do the whole area. You don't just want to do where the intestinal area. You want to come up and do the rectal area of the horse and move it. Same thing if you're talking about a person with very severe constipation. If you want to gently massage the intestinal area to help move things along and to hopefully relieve the situation, that is certainly something that may be beneficial and potentially utilized. Okay, regarding the show pig question, my primary customers are show animals. Pigs respond really well to the treatments with the butterfly at a lower level, while cattle seem a little more comfortable with the large loop. Well, again, you're dealing with a much larger mass of animal and that type of thing. And you might find that same thing when you're dealing with athletes, for example, with the professional athletes that we're dealing with on the college level. We were at UK the other day working with their football team as they're going into training and so forth. But when you're dealing with more muscle mass or more tissue mass, a lot of times the larger loop is more responsive and more comfortable because they get a larger area stimulated at that point in time. Again, it just varies on what they like. But I've seen a lot of pictures where they're doing bucking bulls and they're in the pen and they're using the large loop to move very easily from outside the pen as they're in the area, or in some cases not the new necessarily at this point, but the wave wings to approach those areas. How can MagnaWave help with pleurisy And what would be a good treatment regimen? Well, the circulation improvement that can come to the area, and a treatment regimen would be to treat the area, to utilize and treat the whole body again to get a better blood oxygenation and flow through the body. And so can it be beneficial in that situation? Certainly it's could be beneficial, and we're certainly worth a try to see what the development could be. Okay, my knee, next question. My knee has been at level 10 pain-wise. MRI says surgery, not running to the OR. Understand, just yet. I used the Zoom paddle on 10 yesterday for 4 hours while I was working on a computer. Was able to sleep last night, and the pain was down to a number 1 today. Quite often what we're dealing with is when you get those types of situations, it's in the nerve, more so that it's in the muscle area. When you get into the knees, I mean, there's not a lot of muscle right around the knee area itself. You're dealing with connective tissue, with nerve, and cartilage in the whole 9 yards, and it's difficult to get inflammation out of those areas. And it's just not going to happen sometimes in the first 10-minute session. And in Kathleen's case, to be sitting while working at a computer and place something like that under the knee for an extended period of time to just continue to work on the inflammation out of that area is something that in her case certainly was beneficial. And we've experienced that quite often when you have a situation. For example, I always go back to my personal experiences, but I tore an MCL medial ligament in my knee a few years ago when I was moving into one of our offices, opening a door, and I treated myself 2 or 3 times a day with the high-powered unit to really get after the situation, 2 or 3 times a day for 20 minutes. And then I wore a low-power unit that I was able to bandage basically to my knee for the rest of the day, every day, to keep the pain at bay, to keep it from creeping back in. And I had very successful results in that type situation, as Kathleen did with that. Now, certainly the secret would be for her to continue, not necessarily 4 hours a day. If she's got it down to a 1 today, she needs to do it, and to continue to keep it. As we say, and you've heard me say a million times probably, the routine is to treat as long as function continues to improve. People always ask, when do I treat? When do I stop? Well, as long as you're improving, you want to keep treating. You just want to keep doing that. And then a lot of times you reach a plateau of what's going on, and you want to maintain that. You can't get it any better necessarily. You want to take it and you want to treat as often as necessary to maintain that plateau. For some people that might be once a week, others it might be twice a week, others it might be once every 3 weeks, whatever the situation may be. But it may be several treatments in a row to get to that plateau, or several sessions over a period of time to adequately reach the plateau that you're looking about. Great comment, Kathleen. Thanks for sharing that. Let us know how things go. There are people that are in that type of situation that have been able to pretty much avoid surgery by continually treating and staying on top of the situation. Now, certainly the severity, I'm going back to my folks here from Israel yesterday. He was talking about neuropathy in the feet and what's the best way to treat and how far can you go. And my response to him, well, it depends on the severity of the neuropathy. If someone has got 85% damage or 85% loss of their circulation in their feet, or where they're experiencing the neuropathy in their hands or their feet, legs, wherever it may be, that's a tough one to reverse. But if it's coming on and you want to control it, the quicker you get after it, the more often you do it, the better the result. Again, coming back to Pat, my situation, as my doctor describes it, with an age-related neuropathy, damn things happen as you get a little older. I treat myself nightly. I use the B2, and I got a little process there that I'll kind of tell you about it, but I use the B2, and I rest my feet on a mat, and let them be. The B2 will run at about 500 Gauss for 8 hours. So it's a nice level of Gauss, about let's see, 500 compared to 35, so it's 15 times stronger than some of the low power units out there that only deliver about 35 Gauss during a treatment period. And of course our larger units get into the thousands of Gauss, but this particular unit, the B2, has settings that you can utilize to help enhance sleep, to help relieve pain and inflammation, and I rest my feet on it nightly. And then what I'll do is I wake up through the night and whatever, and I'll move that mat, and I'll rest it over my hips, or lay on it with my buttocks on the mat to, in effect, treat the prostate area, so I can maintain and make sure that my prostate is in good health. I had a prostate scare 3 or 4 years ago, and so I'm very in tune to trying to keep that in check. What I've also began to do is, I need to do a, what do you call it? What's that photography where slow motion? Slow motion, basically.
Yeah, pretty much.
Yeah, time lapse. I need to do a time lapse shot of myself sleeping to see how I manipulate these pads. So now I'm doing my upper shoulders and my head. I'll treat that area or this area for a period of time. And what's my logic here? I'm wanting to think I want to keep any situations in my head and shoulders and neck region in check. I don't want to have inflammation. Again, you think about things as you age a little bit. You want to keep your brain healthy. That's again the purpose of the book that I'm participating in. But to have a happy brain and a healthy brain, to maybe keep any indications that could be an issue, strokes, forgetfulness. What am I trying to think about here? No, those types of situations at bay. So that's my routine with the B2 on a daily basis, to move it and work on various areas. It's very comfortable. I sleep well, and it's very effective for that type of situation, and that's what I do. You can do the same thing, and I do that as well. If for some reason, if we're traveling and I don't have a machine with me at that, or I don't have the B2 with me, I'll certainly use the Maya or the Semi 5, Semi 3, or the Max, whatever I've got available to me, to do the same kind of regimen, but I do it quicker. I mean, I'll treat my head for a few minutes. I'll treat my low back and prostate area for a few 6 or 8 minutes, and then I'll treat my feet on a much higher setting to achieve the same type of thing. So it's whatever's best and whatever is most comfortable for you. As I find myself personally, I got a machine in one of the rooms of our home, and I won't go into that room because we're over in this room, or we're talking this, or we're outside, or we're doing this. So to me, the B2, to use it in the evening is perfect and seems to be working very well. And I wanted to also do that as kind of a test, or be able to bring to you how I use it and how other people can use it as well. Let's see. Hazel Reed, would it be stomach issue or head or inner ear? What do you, Hazel, be a little clearer to me in what you're asking. Head issue, inner ear, will circulation and blood oxygenation help those situations? I would think so. We would certainly hope that it's from that. Depression and PTSD, can MagnaWave help? Yes. One of the stories that I said I'm writing for my book, Wake Up Happy Brain, deals with depression and how we took a client, and we've used it on several people in a depressive state. We learned years ago that PEMF would just provide a sense of well-being. Somebody would treat their upper body or treat themselves, and they'd say, gee, not only do I feel relaxed, I just feel good. And so it just created a sense of well-being. Well, when you're dealing with depression and PTSD, that's what happens. Got a very close relationship with PTSD, and you get into you get anxiety. Depression, a lot of times you're just depressed, you're just down. With PTSD, sometimes you feel attacked. You feel that there's things going on. You're trying to second guess everything that's going on. You're not just depressed. You have this type of fear that takes place. And there are triggers that stimulate PTSD and on a regular type of basis. So there's a lot of things that can be used for that. But we have personally used on PTSD types of situations to treat the body, to provide a sense of well-being, to provide good, again, blood flow and relaxation, helps deal with the fear that someone may be experiencing. And to that end, we're also very close and got to using and became involved with some CBD products in order to help and aid anxiety and depression and PTSD types of situations. And so in conjunction with other therapies, the MagnaWave is shown to be very beneficial on PTSD and depression types of situations. We can discuss that if you had a particular situation that you wanted to discuss. We're certainly happy to do that. Hazel Reed asked the question, let's see, Katie asked, I would treat the head and central nervous system, a lot of times motion sickness. Someone asks about motion sickness. Motion sickness is related to the vestibular system in my experience. You can treat the gut for symptoms too. I'd like to think it's occurring acutely. Just some thoughts. Now I understand the question. I must have missed it, the full question up earlier for motion sickness. Interesting to talk about treating the ear, having the head and the ear in a good, healthy situation as you're going to deal with the motion sickness. Certainly, if someone is a stomach issue and you want to kind of calm that, PEMF could very well be a relieving factor in those types of areas of concern. Great thoughts, great questions. Never thought about it for motion sickness. One of my grandchildren suffers from some motion sickness in the car, and depending where they're positioned in the car and what's going on, it's really strange how that works. Of course, motion sickness on the water. If you're on a fishing boat, been boating all my life. Went deep sea fishing. Never thought I'd have an issue on a boat, but well, actually, those things are kind of contagious. You look at this person and they're having an issue, and then all of a sudden, and it can spread in those experiences at that time. But very interesting thought and facts. And if someone suffers that, I'd love for you to kind of track. And as Kate was talking about. Kate was talking about with regard to motion sickness, so certainly report back to that. Go to the MagnaWave Education, PEMF Education and Resource Group. There you can go and search for various indications. You can also post if you've had experience with those types of things, and so other people can learn from your experiences that you've been able to utilize this interesting modality to get ahead of. Let's see, any other questions? Simply put them in the chat box. We're running close here on time. It's been interesting today with a lot of very good questions. I wish we could have spoken on the phone to someone, but I'm just behind the 8 ball here. But I'm going to get all that squared away for next week. Any questions, guys, that I've missed or anything that you can see?
No, you got them all.
Everything's pretty okay. I got Chris and Tony here helping me this morning to make sure that I'm crossing my T's and dotting my I's, and they're doing a great job as always. And then Chris will be back with us next week. He's been at Comic-Con, and I don't know what's going to come back, but he's been at Comic-Con in Los Angeles for the last week, sending pictures and doing all kinds of stuff. So that's kind of cool. Give you another minute or so if you got a question. Simply put it up there, and I'd be happy to approach it. A lot of things going on. I talked about the B2. I was going to have something else I thought I was going to talk about. Can't remember. Need to get my thing and treat my head. So anyway, we're about out of time. I certainly appreciate you being with us. It's always enjoyable. If you have questions, simply call the office and ask Lee. It's 502-742-7868. If you'd like to call and give a question, if you'd like to email me directly, it's Pat Zemer at MagnaWavePEMF.com. Send me your questions. I'd be more than happy to address them immediately or address them in the weekly office hours programs that we bring to you each week. I'm planning on, just to give you a little update here, on the Castbox. Castbox is like a radio station more than anything, and I'm planning on beginning a regular process of Castbox broadcasts where people can talk very freely back and forth, much like a radio talk show, and present it to where someone's driving or working. They can very easily listen to it. They don't have to be watching necessarily or be on Facebook to hear what's happening. So that's where we're going with the Facebook thing. My first plan is to interview and talk with the other authors in the Wake Up Happy Brain book, and talk with them about what they're doing to help people have happy brains. That's a neat area, and I'm excited about participating with that book. That'll probably be published in the next 90 days. We'll have the book published for you to have a look at. Okay, what about mares who have difficulties getting pregnant? Well, again, if you're dealing with the area, and we've had people who have worked with doctors with pregnancy and ovaries and that type of thing, and again, to treat the area. There are stories, there are testimonials. You go to the testimonial page on women who have used the device, who have had trouble with their pregnancy or becoming pregnant, who have been successful after utilizing this therapy device, again, for blood circulation, blood flow, normalization of the body symptoms or the body makeup of chemicals, and so on and so forth, to find some success there. So certainly to treat mares that are having these difficulties would be worth a try. And again, go to the MagnaWave PMF education page, search that, or look under the testimonials on the MagnaWave page, and you'll see that there's a lot of good things that have happened there, and you can ask those questions and get some very good answers. Okay, let's see, what about, I can confirm, yes, MagnaWave PMF does help with PTSD and depression. Jason, thank you for chiming in. Then when I combined it with the CBD it's allowed me to start backing off my meds. We've experienced the same thing, Jason, with some folks that we deal with that have PTSD. The MagnaWave has been very beneficial. Adding it to the CBD regimen, or adding CBD regimen to that process, we have found to be incredible with regard to sleeping as a sleep aid, and to take as the symptoms begin to creep up as far as PTSD. There is a new site that we're dealing with. If you'd like to take a look at it, it's called jutehealth.com, JUTEHEALTH, jutehealth.com. It's a new CBD product that I'm involved with. We grow it, we process it, and distribute it, so it's totally controlled. We have total breakdowns, certificate of origin, a certificate of authenticity that we're utilizing with it. It's called jutehealth.com. It'll be a product that will be available to the practitioners or to the general public to participate. Practitioners will be able to purchase it and then on a wholesale basis and retail it. It also will have a referral segment to where someone can participate and have their friends purchase, and then they receive a referral or a affiliate payback on that to make it very beneficial and easy to handle from the practitioner standpoint. So again, have a look at that. It's launched. We're going to round up some things and have it really completed in the next couple of weeks to bring Jute Health to the table. So check that out. Let me know what you think. If you have any questions, give me a shout. So Jason, thanks for your input, and I'm glad to see the success that you're having, and I presume that your infection in your knee is still working in the right direction, so you can get back in there and get your prosthetic taken care of that you're wanting to do. Let's see, Samantha Volk talks about working with her daughter to get her more often to seen than twice a month. So there's a lot of situations going on where people are trying to get ahead of various indications and conditions. Okay, great questions. Thanks for the input. Jason, always nice hearing from you folks. Thank you for being with me today. We'll be back next week with another edition of MagnaWave Office Hours. Wave on to better health. Have a great day. Thanks for being with me. Bye-bye.